All right, let's take a quick look at a few chest x-rays so that we can identify some respiratory pathologies. The first one we're going to look at is this one. And the pathology that we're looking at on this x-ray is pleural effusion. We know from our anatomy class last year and from being in clinic for a little while now and seeing chest x-rays quite often that we should be able to see a Costophrenic angle here usually. Now when we can't see that point here, this Costophrenic angle, we know that we have a blunted Costophrenic angle here. And because we have a white color here instead of a darker color like we see up here or in the lung field, we know that we're dealing with something similar, at least, to fluid. And that's what a pleural effusion is, the presence of an abnormal presence of fluid within the pleural cavity. That cavity is encapsulating the lungs and should just have that lubricating fluid in it, nothing else, and certainly not this fluid. So this one, again, is going to be pleural effusion. Okay, so let's go on to the next x-ray. The next x-ray we're going to look at is going to be this one. And what we're looking at in this case is a pneumothorax. So if we remember again from everything we learned last semester and what we're learning now, we should be able to see vascular markings. And vascular markings are these little white, almost like spider web densities that we have here. They're a little denser on this side than usual, but what the main thing we're looking at here is the absence of those vascular markings on this side. Those absence of vascular markings and just full-on air in this side is what we call a pneumothorax. That's when so much air has gotten into that pleural cavity that it's collapsed the lung here on this right side, this lung over here. All right, and the last x-ray that we're going to look at is going to be this one here. What this one is atelectasis. So it's a little harder to see here on the PA, on letter A, this image here. But what they're trying to show you is kind of just sections, mostly where we see a division of lobes, just greater density. We can see it a little bit better for sure on the lateral here, letter B. This is where it gets really highlighted. But what we're seeing is in between lobes, we start to get this increased density here. And again, this is an additive disease. So what we would do in this case is we're going to increase our technique just slightly. And again, this is atelectasis. Now, one thing I do want to note before we leave is that sometimes people get pneumothorax here and atelectasis confused because they're both technically considered a collapsed lung. One thing to note, though, is that atelectasis is an increased and additive disease because it adds in certain things. Fluid, more compactness, it adds abnormal tissues, basically, for lack of a better word right now, into the lung field. Whereas pneumothorax, also a collapsed lung, but it's collapsed due to the abnormal presence of air in that pleural cavity.